you're at a joint session of Congress, the president is there as well, and they ask you this question. Gentlemen, we have an opioid epidemic here in our country. How do we fix it?
It won't come as a surprise to you that there's no two-sentence answer, but let me try and summarize it in 1 or 2 minutes. So first, as we already mentioned, we need to get better and more appropriate treatments for chronic pain, which is going to be mainly, there are some medications that are not opioid medications that are safer, but it's mostly going to be forms of psychotherapy. And that's going to take a huge scaling up. We need to train the people to do that therapy. We need to have a way to pay for it. We need to get it widely disseminated. The second thing is we need to find the people who have opioid use disorder and treat them with the 3 medications that we talked about. So I think and that also is going to take some scaling up to train physicians to prescribe these medications and making sure that our healthcare system pays the cost of those medications. So I think those are 2 very good steps that we could take to put a big dent in the epidemic.
And actually the President's Commission has a whole set of recommendations, and in the executive summary for that, and anybody can Google those, that's really a larger, more complete answer, because it talks about changing prescribing, it talks about changing insurance kinds of things, it talks about access, and it's way too detailed for me to go through all those points, but there's half a dozen key points in doing that, and actually I think they're good ones.